Welcome to the deep dive. Today, we're tackling something really key for staying healthy: how we decide to treat ourselves when we're not feeling great. We've gathered some, pretty insightful information about why getting professional advice is so crucial instead of just, grabbing something from the medicine cabinet.
It's definitely relatable, that impulse for a quick fix. And if you think about places like India, for example, where lots of medicines are available over the counter.
Right.
And people might have old prescriptions lying around, well, you can see why self-medicating feels like the easy or maybe cheaper path.
Absolutely. And that's precisely what we want to dig into in this deep dive. Our aim is to give you, the listener, a really clear understanding of why avoiding that is, frankly, vital for your health.
Yeah.
We're going to unpack the information we have, look at the risks, and guide you towards, hopefully, safer healthcare choices.
So maybe first things first, let's nail down what we actually mean by self-medication based on what we've seen.
Okay, yeah. So essentially, self-medication is taking any medicine without a doctor prescribing it for your current situation.
Right.
That could mean using advice you got from a friend or something you read online, maybe reaching for an old prescription because the symptoms feel familiar.
Or even just asking a pharmacist for something without a proper doctor's diagnosis.
Exactly. All of that falls under this umbrella.
And, while it might seem like a speedy solution when you're feeling under the weather, the consistent message we're seeing is that this shortcut, it can lead to some quite serious health issues down the line.
For sure. And one of the biggest dangers, perhaps one people don't always think about, is getting the diagnosis wrong. Think about a headache, right? You might just assume, it's stress, and pop a painkiller.
Yeah, common reaction.
But the information we looked at points out that headache could actually signal something else entirely. Maybe high blood pressure, maybe an infection brewing.
And what's really key there is that by treating the symptom, the pain, you might feel a bit better temporarily.
Right, you mask it.
Exactly. You mask it, but you're not dealing with the root cause. You could actually be letting a more serious condition just, get worse without realizing it. It's like hitting snooze on your body's alarm system.
That's a great way to put it. And this gets particularly worrying when it comes to antibiotics.
Oh, definitely.
We've seen information showing how common it is, particularly in places like India, for people to take antibiotics for, say, a fever or a sore throat, maybe a cold.
And often they might not even finish the course from a previous time.
Or they're just taking them without any medical input whatsoever.
And if you step back, this widespread antibiotic self-medication is a massive driver of antibiotic resistance. It's a huge problem.
Explain that a bit more. How does that work?
Well, basically, when bacteria get exposed to antibiotics they don't actually need, or for too short a time, the tougher bugs survive.
Oh.
They learn to beat the drug. So later, when you really need that antibiotic for a serious infection, it might just not work anymore. And that makes illnesses much harder and, frankly, more expensive to treat. The sources suggest this is already a pretty serious public health crisis in India.
That's quite alarming. And it's not just the prescription stuff, is it? Even the over-the-counter things, the stuff you can just buy easily, they carry risks too if we self-medicate.
Absolutely. The information we reviewed is clear. Even common painkillers like paracetamol or ibuprofen, if you take too much, they can cause liver or kidney damage. They can also interact badly with other medicines you might be taking, like for blood pressure, diabetes, things like that.
Right. Interactions are a big one.
Yeah. And then there are the side effects, stomach ulcers, dizziness, maybe allergic reactions. And the crucial thing is, what's okay for one person might be really harmful for someone else. Think about kids, pregnant women, older adults. They're often more vulnerable.
So beyond taking the wrong pill or having a bad reaction, there's also this issue of delay, isn't there? Delaying proper treatment.
That's another critical point. What happens when you try to treat something yourself that actually needs a doctor's intervention?
Like what sort of things?
Well, the information mentions examples like typhoid or dengue fever, even things as serious as cancer. If you're just managing symptoms at home.
You're losing valuable time.
Precisely. You delay getting the right diagnosis, and that can make the condition way harder to treat later. It might even mean needing hospitalization when perhaps earlier treatment could have sorted it out more easily.
It's like trying to patch up a deep wound with a tiny bandage.
Exactly. And that ties into how self-medication can mask serious illness too.
How so?
Well, like we said with the headache example, taking a pain reliever or something for a fever might make you feel better for a bit.
Sure.
but it can actually make it harder for a doctor, when you eventually go, to figure out what's really going on. The symptoms are dampened down.
Ah, so that temporary relief could actually lead to a misdiagnosis, or the doctor not realizing how serious it is.
Potentially, yes, or at least make their job harder. You lose time. The real issue isn't tackled effectively.
We also saw a list, didn't we, of medicines commonly overused, particularly in the Indian context, and their risks.
We did, yeah. It's quite eye-opening. Antibiotics, obviously resistance, messing up your gut bacteria.
Right.
Painkillers like NSAIDs, risk of kidney damage, stomach ulcers, steroids that can mess with your hormones, make you more prone to infections.
Antacids.
Even antacids. Taking them constantly can hide serious stomach issues. Cough syrups, risk of addiction, drowsiness, sleeping pills, dependency, memory problems.
It really drives home that these aren't just harmless pills.
Not at all. They're powerful substances.
So, okay, we've seen the dangers. What are some of the typical mistakes people make when they do decide to self-medicate?
Well, a really common one is using leftover prescriptions. Oh, I had this cough last year, I'll take the same syrup.
But the cause might be different this time.
Exactly. Or your own health situation might have changed. That old prescription might be totally wrong now, or even harmful.
Okay, what else?
Using over-the-counter stuff without really reading the instructions or understanding the risks, just because it's easy to buy doesn't mean you can ignore the dosage.
Or the warnings.
Right. And you really should see a professional if things aren't improving or they get worse. Don't just keep taking it.
Makes sense.
Then there's taking multiple different things for what seems like the same symptom, trying to hit it from all angles.
I can see people doing that.
But that massively increases the risk of overdose on a particular ingredient or dangerous interactions between the drugs. Not a good idea unless a doctor specifically says so.
And the last big mistake.
Forgetting about your own unique health profile. Not thinking about allergies you have or conditions like asthma or heart problems.
Ah, right. Because some common cold medicine ingredient could trigger an asthma attack, for example.
Precisely. Or a painkiller could worsen a heart condition. You have to consider the whole picture.
Okay, so given all these pitfalls, what should we be doing when we feel unwell?
The absolute #1 piece of advice, coming through loud and clear from the information, is consult a qualified doctor first.
Even for seemingly minor things.
Even for common symptoms. It's the crucial first step. And the good news is, as the information notes, things like teleconsultations are becoming more common.
That makes it easier to get that initial advice, doesn't it?
Definitely. And when you do speak to the doctor, be really clear and honest about all your symptoms.
Like how long they've been going on, how bad they feel.
Exactly. And mention anything you've already taken. That full picture helps them diagnose accurately.
And what about pharmacists? Is it okay to ask them for advice?
It's probably best to avoid putting pressure on them to give you medication without a prescription. They can give general advice, sure, but they haven't examined you or diagnosed you properly.
Right. Stick to the doctor for diagnosis and prescription. What about those old prescriptions we mentioned? Should we just throw them out?
Well, maybe keep them for reference to show your doctor your medical history. But definitely don't reuse them on your own initiative, only if the doctor specifically tells you to.
Okay. And for families, any specific tips?
Yeah, the information suggests educating everyone in the household, including elders or domestic help, about the risks. Don't share medicines.
Good point.
Store old medicines safely, out of reach, especially from kids and teens, and talk to teenagers about the dangers of self-treating things like skin issues or sleep problems.
That's important. And just to circle back on over-the-counter meds one last time.
It's worth repeating. Just because you can buy it easily doesn't mean it's harmless. The wrong dose, mixing it with other things unknowingly, using it long-term without checking in with a doctor all carry risks.
Okay, so let's try and wrap this up. Key takeaways from this deep dive.
Well, I think the big ones are self-medication masks symptoms, risking misdiagnosis.
Right. It can lead to incorrect treatment, harmful drug interactions.
Definitely contributes to antibiotic resistance, a major global issue.
And can have dangerous side effects, even with common drugs.
So the alternative is always, see a doctor first. Use meds only as prescribed for you, now.
Keep track of your symptoms to tell your doctor. Be careful with over-the-counter stuff. Don't overuse it.
And if symptoms are severe, get help immediately. Don't wait.
There was a quote in the information we looked at, wasn't there?
Yes, informed care is safe care. Self-medication is silent harm. I thought that put it really well.
Yeah, it does. Your health really is too important to gamble with, isn't it?
Absolutely.
Oh.
Always see a doctor. That seeming shortcut might end up being a much longer, harder road.
So a final thought then for everyone listening, thinking about all this. What's maybe one practical step you could take starting today to shift away from self-medication habits for yourself and maybe for your family too? Something to ponder.